So basically, my research is focusing on nutrition interventions and their relationship with maternal and infant health. I worked my research paper with Claire, who is my mentor. Okay, so basically a brief introduction about myself. I'm a senior student at Shanghai, and some of my extracurricular activities including volunteering at the food bank and organizing food donation campaigns. And I also aspire a future career in food science and food security, so that's partly the reason why I start my research with Polygence. Okay, so among all those different issues regarding food crisis and nutrition problems, why I select maternal and infant malnutrition? First of all, I think it's just common sense that women need extra nutrition during her pregnancy and breastfeeding period because she not only needs to support herself but also support the babies. Second of all, meeting them is really critical for women's health and significantly impact the children's development before 5 years old. So the maternal and infant nutrition is not only about the present but also about the next generation. Under maternal malnutrition, it is usually exemplified as low energy intake or low dietary diversification. In some developed countries, obesity can be also a maternal malnutrition, but as my study is focusing on low and middle income countries, I will not include that in my speech, but I really want to explore that also in the future. Okay, so why maternal malnourishment is a global issue, why it is crucial, and why should people research about that? First of all, an amazingly large number of girls and women are actually suffering from malnourishment right now. So, if they choose to be a mother in the future, this will not only increase their burden, but also affect their babies, as I have mentioned before. Second of all, because of COVID-19 and different warfares, the malnourishment of the women are continually worsening. So that's the reason why we should put even more focus on that because of these current scenario of the world. Last but not least, the number of pregnant and breeding mothers suffering from acute malnutrition has soared by 1.4 million in 12 most affected countries because of COVID-19 and Ukraine, which fully suggests that they not only need urgent help but also need very effective help. So, this is the reason why I not only focus on malnourishment about the mothers, but also specifically the types of nutrition intervention programs that may effectively help them. So, there are three main types. The first is cash transfer, which means that you give the mother's money or give the household money. And second is the most common one and most well known, which is just distributing food and distributing nutrients-based supplements. And the last one is a little bit complicated. It is called social behavior change counseling program. It is not about material giving. It is not about giving mothers food or nutrients or cash. It is about educating, like how they can distribute the limited resource in order to meet a balanced diet, the importance of breastfeeding their children, or the importance of balanced diet, these sort of things. It's about education. So the full name of my research is a little bit long. It is called A Review Evaluating Nutrition Interventions on Maternal and Infant Health in Low and Middle Income Countries. So this is a review research. I categorized interventions into three types, and I also analyzed some factors that might affect the results. So I really hope that this research can be a guide for nonprofit organizations or healthcare organizations if they want to address those malnourishment issues. So I will just talk about my findings one by one of the three types and talk about their limitations. So the first is cash transfer. It can increase the financial ability of the mothers, so they can either use the money to ensure the food safety or improve the food diversity. The cash transfer can also increase their access to healthcare services, so they can indirectly improve maternal and children's health by preventing mother-to-child HIV transmission, because the mothers may have money to purchase these healthcare services and do the measures to avoid the transmission. However, cash transfer has the most limitations among the three types, I would say. First of all, unconditional transfers may not always improve diets. People may use the money to buy things other than food. And in some regions, male family members control finances. So even if you give the money to the families with pregnant mothers or breastfeeding mothers, the family member may not view improving the diet or prioritizing women a top priority, so the program's impact will be limited. And also, cash alone is not enough. If you give them the cash, you need to tell them the importance of balanced diet, and you need to tell them how to increase the food diversity, or they will use the cash for somewhere else and have limited impact, really limited impact on malnourishment, especially those for mothers and their infants. Okay, the second category is about food and nutrient-based supplements. So the first is direct food distribution without further say because they're easy to understand. And second is about macronutrient supplements. You give them protein bars, you give them lipid-based nutrient supplements. And the final one is about micronutrient supplements, such as the vitamin pills and iron folic acid. So basically, these nutrient and food-based supplements, they are rather effective. They can increase the infant birth weight, they can increase cognitive development, they can prevent high blood pressure during pregnancy, and they can decrease the likelihood of stillbirth, which means that the children are born but they're dead. So which is a really bad phenomenon that we do not want to see, and these iron folic acid supplements can solve that. However, they also have very big limitations because supplements are really costly. You require a distribution facility, you need to restore them, and you need to transport them from place to place. Also, because some supplements they are pills, women may refuse to take them because they do not want the others to think they are ill and they have any kind of disease. So which is something we should continue to keep in mind if we want to distribute those pills. So the last category is about social behavior change and communication. Among all these different kind of social behavior change program, those three main one are the things that may potentially affect the maternal malnourishment and some of the main communication programs. The first is about contraception counseling. By taking contraceptive measures, the woman can avoid giving delivery too frequently, which will significantly harm their babies, and they can ensure that they're having children in their healthiest time. The second is about breastfeeding counseling, which can increase exclusive breastfeeding, which help to build the immune system of the children, and it is also good for children's health and nourishment. The final one is about lifestyle intervention, which can reduce the obesity during pregnancy and after pregnancy. Social behavior change communication programs also have limitations because they can only alleviate malnourishment indirectly. They will never be as effective as giving their money or giving their food, in my opinion. And cultural beliefs, social norms, and gender empowerment may impede the success rate. I talked about contraception methods. However, in the culture where they believe that more children are better, or in some cultures that abortion is immoral or illegal, so these contraception methods may never really work. And under some traditional family structure, even though people have scientific knowledge, they know that exclusive breastfeeding is good for my children, but they may still obey their mother or father-in-law because they believe the experience may be a good thing, even though some traditional family structures they are no longer useful. So finally, there are some common factors that can affect both all of those three intervention programs: the religion, gender inequality, and traditional belief. So you can just have some time to read those things and just keep in mind that those are things you need to consider if you want to implement any of those programs. And there are also limitations for current study. during my review study, I realized there should be more study focusing on the post-pandemic period and the nowadays situations. And also for food and nutrient-based supplement, studies are mainly focusing on infants' health rather than the potential risk for their mothers. So there is one field that researchers can continue to explore in the future. So we also have some things can do to ensure the maternal nutrition on our individual level and on our community level. So I would like to thank Polygence for giving me the chance to share my research and thank my friends for always supporting me to explore my interest in the field of global health. And finally, thank you all for listening.
Amazing. Again, I learned quite a bit. Hold on one second. I want to read a question. So, how is the war in Ukraine worsening the situation outside of Ukraine? Can you comment on the global impact it's having on maternal nutrition?
Okay, so Ukraine is just one of the largest crop export country, I will say. So, it is a really important part in the world food system because it is undergoing warfare. So I think the crop they are not producing as much as in the last years. So this may increase the food insecurity problem over the globe, and this will actually they will affect maternal health at the end of the day.
Mm, okay. And what was the most interesting thing that you discovered in your research?
I would say that even if people have a lot of scientific knowledge, they will just abide with I don't know, their mothers would say, such as I read a report like a nurse, she knows that exclusive breastfeeding is good for her children, but she still obeys what her mother-in-law says, which is giving children water when they are very young, which is not good for their stomach. So, yeah, this is just interesting how science usually conflicts with traditional belief. And I believe that these are the things that exist in a lot of fields, not only in the fields of public health and environmental science.
Well, thank you for educating us on this topic. Again, I learned a lot and I appreciate it.